Hello, everyone. As you guys are trickling in, I'm just going to introduce myself for those of you who were not on yesterday's call. My name is, first of all, today is day 2 of a 3-part workshop series. We did the CBC yesterday, and we will be doing thyroid today and then lipids tomorrow. And my name is Dr. Monica Sood. I'm a conventionally trained medical doctor in internal medicine as well as anesthesiology, and I have been transitioning into a more holistic type of medicine called functional medicine, where we like to get to the root cause of disease. And so today's presentation, we're going to be talking all about the thyroid. So first, I explained this yesterday, and I want to just go over this again, that the way your blood tests, the way that the labs get their reference ranges, which are within normal range, is because they take all of the people who have ever taken that lab test in their lab, that's hundreds of thousands of people, and they take that, whoever is within 95%, that is the reference range for their lab, and that becomes within normal limits. And what is 2.5% higher than the rest of the 95% people, they call them as abnormally high, and 2.5% on the lower end is abnormally low. And so in functional medicine, what we are looking for is optimal. We believe you should be in this range, because when you're getting out to this range, already things are not working the way they're supposed to. So we look at a much more narrow range, and it's more of an optimal range for you to feel at your best. So for the thyroid, I just wanted to describe it. It's a small butterfly-shaped gland located at the base of the neck. It's a part of a huge system, endocrine system, and the thyroid hormones communicate with every cell in your body. This thyroid produces the thyroid hormones, which are crucial for the basal metabolic rate, your metabolism, energy production, and many, many, many other things, which we'll go over in just a little bit. So why is your thyroid health essential? It regulates your metabolic rate. It controls your heart rate. So people who have hyperthyroidism or too high levels, they'll often notice that they have a racing heartbeat. And people who have very low thyroid levels might have a very slow heartbeat. So it actually affects many parts of our body, including the bones as well, for bone resorption. It affects the weight and your body temperature. For those of you who are always feeling kind of cold and you feel like you can't lose weight, the thyroid function might not be optimal for you. And a lot of people who always feel that they're cold all the time, oftentimes they do have a subclinical hypo, meaning underactive thyroid. It also regulates the production of proteins. So we're going to go over the different thyroid hormones. This is one that most likely all of you guys have had on your annual exams at least once in your life. And this is called the TSH. The TSH stands for thyroid stimulating hormone. And this is actually produced in the pituitary in the brain. And this is what regulates the production of all the thyroid hormones in our body, which is T4 and T3. And there's also research on another T2 hormone, which is not, it doesn't have much of a function. But this is often the first thing that our doctors will check. And sometimes this is the only marker that they check for thyroid. They don't even check the T4. If you're lucky, you're going to get the TSH as well as the T4. So the next is T4. This is thyroxine. This is the primary hormone that is produced by the thyroid gland. In fact, that's 90% of the hormone that the thyroid gland actually produces. But this is considered more of a pro-hormone, because this needs to be converted into T3, which is the active form of your thyroid. Most oftentimes, I can guarantee that if you go and get your blood work, the doctors are not going to be testing for T3. They just test for TSH and T4. So these levels can be an indicator of the thyroid's overall functioning. So T4, we talked about TSH, T4, and now we're going to talk about T3. So T3 is a very small percentage, but this is the metabolically active thyroid hormone. So this is the active form of the thyroid. It's the T4 that gets converted into the T3. And it is responsible for most of the thyroid actions in our body on all the receptors. So both free T3 and total T3 levels are actually important for diagnosis because we also get a total level. Our thyroid hormones and other hormones are often, they're bound to proteins, and that's how they get around in the blood. And then they have to be released into the free form, which is what acts on our receptors in our cells. Okay, so reverse T3. Reverse T3 is something that you may not have heard of. Again, conventionally speaking, we don't test for this. And reverse T3 is also produced from T4. And this is basically like the brakes on the thyroid. The free T3 is the gas pedal, whereas reverse T3 is the brake. So T4 can either form T3 or free T3, or it can form reverse T3. And we don't want the reverse T3. And there are several things that can cause an increase in the reverse T3. These are stress, illnesses. Sometimes your receptors are not working, which we'll go over in the next couple of slides. But if there's a high reverse T3 as compared to the free T3, we can take that ratio. This means that there's a conversion problem and that T4 is going in a pathway that we don't want it to go into. Next up are thyroid antibodies, and there's a couple of them that we measure. And again, sometimes the doctors won't test for them, but I think it's important because you may have symptoms of Hashimoto's or low thyroid, and we want to test for these antibodies, which, if they're present in high levels, means that there's basically an attack on the thyroid gland. So I do like to measure both of these. Now, okay, so now we're going to talk about the different numbers, conventional versus functional. So here, normally in your reference ranges, it may vary just a little bit based on the labs, but generally speaking, if your thyroid, your TSH, which is the hormone that is made in your pituitary, the thyroid stimulating hormone, which tells the thyroid to make T4, the normal range is generally between 0.4 and 4 for the conventional labs. Whereas in functional medicine, we like to look for a much narrower interval. In fact, 3 is my upper limit of normal. Now, normally in conventional medical training, we are taught that just get the TSH. If the TSH is good, we're good. We don't have to worry about it. But we like to get this whole panel. So we include this in every single client that comes to our clinic. They get a full thyroid panel, which includes the TSH, the T3, T4, which are total levels, which are bound to proteins, free T3, free T4, anti-TPO, which are the antibodies, anti-thyroglobulin antibodies, as well as the reverse T3. This is all going to make sense in the next slide or so. So here are our ranges. Like I said, they go in conventional, they say 0.4 to 4.5 is considered normal, whereas we're looking between 1.3 and 3. So that range for optimal levels. So you can go through all of this for the thyroid to see. And we do this for everything, vitamin D as well. You know, in conventional, they say 30 to 100 is good. We like above 50. So we're looking at that optimal range that we discussed in the beginning. Now, the layout of the thyroid system. There's all these different systems that actually communicate with one another. Up top is the hypothalamus, which releases TRH, which is thyrotropin releasing hormone. We're not going to talk about that, but that goes into the pituitary, which the pituitary gland will release TSH if it senses that our basal metabolic rate is low or that we're not producing enough thyroid hormone. So when we're testing for this, an increased TSH means you probably have a low T4, active thyroid. So when this number is high, that means what's in the body is low, and it's a negative feedback loop mechanism where if your body is not producing enough thyroid, it tells the brain, the pituitary, pump out thyroid stimulating hormone to produce more of the T4, which comes from the thyroid. So here's that diagram that we're talking about. So up top is going to be the pituitary, which releases TSH, and it releases TSH if T4 is low. It's telling the body we need some more thyroid hormone. So when that happens, TSH will cause the thyroid to produce T4. T4 is 90% of what the thyroid pumps out. Now, T4 can either become the active form, which is what we want, the T3, or it can become the inactive form, which is reverse T3. And there are many things that actually inhibit the proper production of these hormones. So things that we talked about yesterday, for example, stress can increase the cortisol and it can really affect the endocrine system. There's infections, trauma, radiation, medications, fluoride, and that's an antagonist to iodine, which iodine is what is attached to the thyroid molecules. So T4 has 4 molecules of iodine, whereas T3 has 3. So we need iodine. And then other toxins. There's many, many things that actually can make the T4 go into, inhibit it from even going down this pathway. Okay, so these are a couple of the things. And then there are other factors that contribute to actually increased production of and proper production of the thyroid hormone, which is the T3 that we want. And some of those are nutrients such as iron, iodine, tyrosine, zinc, selenium, vitamin E, and all the B vitamins, C and D. So all of these things are very important, and they help to increase the conversion of the inactive prohormone T4 to T3. And that's not fully inactive, it's just mostly inactive. So we need this, we need both. Now, selenium, some things that you can do through the diet, for example, the recommended dose is selenium is 200 micrograms, and you can actually get that by eating 2 Brazil nuts a day. So this is where, with the diet, we can also kind of help push conversion of T4 to T3, the active form. Excuse me. Next up is, so these are the important ones, selenium and zinc. And in fact, there's a lot of supplement companies that have supplements specifically targeted to the thyroid, and they'll definitely have these 2 components in them. Now, the T4 to the reverse T3, which is acting like a brake, here are some things that can increase the conversion down this pathway. So again, it's stress, trauma, low-calorie diets have been also shown to increase this conversion this way. Inflammation, which can actually also even be caused by stress or an underlying infection. Toxins like the heavy metals, infections, liver and kidney dysfunction, and certain medications. So that these are all the things that are what we don't want, which is going to go from T4 to reverse T3. This is what we do want. Now, one more thing we have to worry about is that nowadays, with all the stress in our lives, a lot of us have chronic inflammation. And because of that, sometimes we have our receptors, like the cell membrane, even if you're making all these conversions, it's not getting into the cell membrane. And so there are certain things that improve the sensitivity so that the thyroid hormone will actually get in to the cell and into the nucleus and the mitochondria, which is what makes all the energy in the body. And a couple of these things that have been researched is vitamin A, exercise, and zinc. And also, I'd like to add that healthy omega-3s and like consuming healthy sources of fats are really good for this cell membrane as well, which is made up of fats. So this is what I was talking about. Sometimes you may have the hormone coming down, but it's not actually able to penetrate and get into the cell to do what it needs to do because the cell membrane integrity is not intact. So again, these 3 things plus healthy fats to improve the permeability, which means allowing the hormone to actually get into the cell. Now, there are different things to look out for, and the main ones that I think that we all kind of have heard about for low thyroid is if you have thinning hair, or if you have weight gain, you can't lose weight, or if you're always feeling cold, dry skin, puffiness, brain fog, all of these things. So there are some people whose excuse me, labs look normal, like the TSH looks normal, but when we go down and look, we see that they're not making the T3, they're making mostly reverse T3. So they actually do have a functional hypothyroidism, which we wouldn't know unless we tested for all the different thyroid markers that we talked about. Now, so these people tend to be on the heavier side and have these symptoms, whereas people who have an overactive thyroid tend to, they can also have hair loss, but you would know it. If it's very overactive, it's called Graves' disease, where they have the bulging of the eyes, usually very, very thin. The heart rate will be very, very high. They'll be usually they're very thin, like I said, thin. They may have diarrhea. They like to eat a lot. Muscle weakness, anxiety, and nervousness are two big ones to look out for with hyperthyroidism. So basically, this was a short, very short lecture. I just wanted to show you that there's many more lab tests that are out there when you are considering your thyroid. So not just the TSH and the T4, but we need to get the whole panel where we see that the TSH is making T4, enough of it, and that it's going down to the active free T3 form and not so much the reverse T3. And we also want to get antibodies because there's a lot of things that we can do. People who have been diagnosed with Hashimoto's, we've seen many, many people reverse their Hashimoto's, and Hashimoto's is diagnosed when you actually have the antibodies through diet and exercise. In fact, many, many people have gone to, they become gluten-free and dairy-free, and so their inflammation goes down and their antibody markers come down. So there's a lot that we can do with diet and lifestyle. Eating foods that have seaweed in them and good sources of iodine. Also, if you eat fresh fish, all these things are good. Then, of course, we have to talk about the reducing stress through meditation, yoga, breathing exercises, prayer, whatever that looks like for you. The stress component is huge, and it's actually a chemical. Like, it's not just something that we think is going to help. It's been proven and it's been studied, the changes that happen in our body. And all of our systems are interconnected. All the hormones are connected. Today, we just talked about thyroid, but everything is interconnected. So, and then of course we want to avoid exposures to toxins, specifically those found in plastics, and then the pesticides that they spray on our food. It's best to go organic and local if possible. And then the other thing is also the household products that we use, and there's some healthier alternatives. If you notice, there's a lot of makeup brands and skin creams and all that now say they don't have phthalates, so they don't have parabens. So people are kind of catching on to this, and they're trying to come up with cleaner sources, whether it's for the food, whether it's for our creams and our makeup, and even for our household products. So I just wanted to go over this. I went over this yesterday. This is the complete blood work panel that we get on every single client that comes to our practice. And as you can see, we talked about CBC yesterday, but we get all of these. So we get the TSH, free T3, free T4, T3, the antibodies, and reverse T3. And why we have to get the total T3 and total T4 also is because we want to make sure like how much of it is bound to the protein versus how much is free. So we get a much better picture to see what's going on in the thyroid when we have all of these. And for the males, we just add in the PSA and the free PSA. And that is it. Today was short. I just wanted to share with you about the thyroid and really empower you that when you go to your doctor, if you can get them to order all those labs, I think it would be very, very helpful.